and welcome to another edition of the morning show right here on the New Main Street TV. Jennifer here, and we hope that you are having an excellent morning with the sun shining and the birds chirping and the pollen flying. We may have a solution for you with that, though, because our friends from Holzer are here, and we might ask them about that, what to do about the pollen flying. But in the meantime, our good friend Pete Wilson is here to kick off our morning with the morning news update, as always, brought to you by Nia Henry, agent for Appalachia Realty. If you're looking to buy or sell or have any real estate needs for that matter, give Nia a call because she's always out working, and why not have her out working for you? All right, Pete Wilson, what is going on in the world of news today?
Okay, well, we do have some fresh updated reports about the COVID-19 status here locally in Jackson and Vinton counties.
Okay.
The Jackson County Health Department came out with a new report yesterday covering the previous week. The dates covered there were March 15th through the 21st, and there were a total this time of 22 new cases in that 1 week period. So that's an average of a little bit over, 3 cases per day.
Yeah.
And that's falling right in line with the 2 previous weekly reports. One of them was a little over 4 cases per day, and the other one was about 2 cases per day. So, 2, 3, 4 cases per day. It's very sustained decline in the COVID-19 cases. Unfortunately, though, there were 2 new COVID-related deaths in Jackson County.
Oh, no.
Which pushes our overall death toll to 59. And when you think about the total numbers, our cases in Jackson County now up to 2,768 confirmed cases, 189 probable cases. As we've mentioned, the 59 deaths. There have been a total of about 170 people who have been hospitalized through this whole thing. That goes back to April the 7th, of course. And so, the 2 things you come away with, it's a mixed message. Number one, we are definitely have turned the corner, and we hope we're moving towards coming completely out of this thing, if such a thing can happen. But the bad thing is it's still here. Jackson County Health Commissioner Kevin Aston released a statement last Friday that I don't think I talked about yesterday, and that is, to continue to be on guard. And certainly the news about those 2 latest deaths underscore that. The virus is still out there.
Yes.
We have a period now where, you talked about all the birds singing and the great weather. People are out, they're doing more things. Mm-hmm. Some events are being allowed again. The restrictions are being eased, and all that is probably right and proper. But also, even with the vaccinations taking place, everybody has not had their vaccination yet. There is still a threat there. And so, we need to be on our guard, on the social distancing. The vaccines are out there to be had. We're going to give you the update on availability here in just a second. But the big deal, the big thing is that it's not over yet.
Pete, it's interesting. One of our staff members does not have COVID, but has a family member who contracted it. So this person has been quarantined, and we haven't had to deal with that since like Christmas time. And I told Jamie, I said, God, I'd forgotten about, I didn't even think it was a thing anymore, like, because it's been so long, and you just aren't really hearing about it anymore. But it is out there, and we still do need to keep our guards up and whatever. So please make sure that you're careful and wear your mask and do all the right things. Well, as our friends from Holzer are going to tell you here in just a moment.
Right. Well, we are down, once again, still the numbers don't lie. We're down to 11 active cases right now in the entire county.
Yeah.
It was 45 just a little bit more than a month ago. So that tells you in numbers how much better we're doing.
But don't let your guard down.
Don't let your guard down.
That's right.
Because, it's still there. In Vinton County, a new report from Vinton County, the Vinton County Health Department, for the 4-day period that covers March 19th through March 22nd, they reported 6 new cases in that 4-day period. There is the infographic up on your screen for Vinton County. As you can see, no new deaths, but they have had 17 total. Nobody in the hospital in Vinton County because of COVID. That is great. However, they did hit a threshold, 700 confirmed cases now in
Mm.
Vinton County. Now, Vinton County is lightly populated, about 1/3, a little bit more than 1/3 the population of Jackson County, but 700 cases is still a lot also, in a county of that size. And even though they are yellow, which means they're in that category 1, where it's the least spread of the coronavirus, still there are cases, as shown by these latest reports, 6 cases in the past 4 days in Vinton County. Okay, now we want to tell you about the latest opportunity on the vaccines, and this is pretty big news. As you know, the eligibility has been spreading in recent weeks as there's been more supply of the vaccine spread out all over the place. The Jackson County Health Department and Health Commissioner Kevin Aston announced late yesterday afternoon that there will be 3 clinics this week at the Jackson First Church of the Nazarene. That is the place where they're doing the vaccinations for the most part now, because it's a little bit bigger, a lot bigger, as a matter of fact, than the health department building downtown. 3 clinics, March the 23rd, which is today, also March the 25th on Thursday, and then on Saturday, March the 27th. And the big news is that they have expanded the eligibility in Jackson County to ages 16 and older. Statewide, that's not going to necessarily happen until March the 29th, next Monday.
Okay.
However, because of the availability of the vaccine and the fact that not all the slots are being filled for the available vaccine in those counties, Jackson County obviously is one of them, they are going early on the ages 16 and up. Now, that doesn't mean that if you're older than that, you're in the 40 and up category, the 50 and up category, and so on, that you can't go. If you haven't got the vaccine, you can. You are grandfathered in kind of on all these new clinics, at least in Jackson County, as far as the health department is concerned. And so the clinic today is not until 4 o'clock. It's 4 o'clock to 6 o'clock at the Jackson First Church of the Nazarene. Once again, it's walk-in, no appointment or anything like that. I've talked to lots of people that's been there, and it's not much of a wait. They have it down kind of to a science, at least from what I have been told and my own personal experience goes. Later this week, there will be an appointment a clinic at the First Church of the Nazarene from 2 to 7 p.m. That's on Thursday, and then on Saturday from 10 a.m. to 2 p.m. So you have those 3 opportunities this week, once again, to get the vaccine at the Jackson First Church of the Nazarene through the Jackson County Health Department. There are other, of course, vaccine providers in both Jackson and Vinton counties as well. So once again, this is free. You don't have to worry about an insurance card or income eligibility or referral or anything like that. It's out there for you to get this service. Have you got yours, Jen? Not yet.
No.
I was wondering what your experience was.
Well, we were just having this discussion, and I got a little bit of a bad girl from the girls from Holzer because I haven't been yet. But I have a good excuse.
You're busy.
Kinda.
Okay.
Yeah.
Now, see, I wasn't.
But I will.
I wasn't sure about the 40 and up, but I know you're in the 16 and up category, so you have no excuse.
Pete, you're my favorite.
Okay. Well, anyway.
Hey, Pete, can I jump in here real quick just to correct something you said? You said that the clinics this week are for anyone 16 and up. It's actually 18 and up because they only have the Moderna vaccine.
Oh, that
which
is
hasn't been
that is
approved
correct.
for
It is
18
18 and up because of the
the
Moderna vaccine. Okay, it is ages 18 and older. Next week for everybody, it will be ages 16 and up.
Okay.
So, and that's statewide.
All right.
So it is 18 and up. So you 16 and 17-year-olds, you got to wait just a little bit longer. Okay, Governor Mike DeWine did another press conference yesterday, and of course he announced about the vaccine eligibility being extended in those counties where there's an ample supply of vaccine age-wise, and that is 16 and older. In many places in Jackson County, only 18 and older because of the Moderna vaccine situation. But one of the big announcements he made was an easing of restrictions in the nursing homes and the assisted living care facilities. Of course, now visitation is restricted at most of the nursing homes. You can only come for a certain amount of time, and you have to book an appointment. Here is what is going to happen very soon. He announced that this would happen. It's not happened yet, but he said a health order would be coming. When he says that, it's usually within a day or two. But here is how the nursing homes will change, and this affects a lot of people. Ohio is requiring that visitation be permitted whenever safety protocols can be met. Previously, visitation was permitted but not required. So all the nursing homes and assisted care living facilities will have to do this unless they have a special situation with the virus. Vaccinated residents may have physical touch with the visitors while wearing a mask. Previously, touching was discouraged. That's a big thing with a loved one, to be able to give them a hug. Visits may occur in a resident's private room as opposed to the previous requirement of a separate visitation area. So that will definitely open up, I think, the possibility for more visitations. As a visitor to a nursing home myself in recent weeks, it gets booked up, and you just can't go anytime you want, and sometimes you're on a waiting list. And when you can go, if you're a working person, may be a little bit different than if you're not. So this is important. Also, 30 minutes should serve as the minimum amount of time for a visit. Previously, 30 minutes was the maximum time for a visit. So that's the latest on COVID-19 covering the waterfront. Last night, we received information. It's not been in the paper yet, but I know a lot of people in the Jackson area are interested in this. They've announced the contestants for the 2021 Jackson County Apple Festival Queen. There are 11 contestants this year. I'm going to give you their names. These girls, 10 of them are from Jackson High School: McKinley Morris, Katie Brown, McKenna Folden, Kendall Osborne, Peyton Taylor, Olivia Moore, Gabby Webb, Patricia Swisher, Riley Crabtree, Jenna Lewis, and there is one candidate from Oak Hill, Kirsten Clark. There are no candidates from Wellston. But the contest will be held, if you don't remember what we've reported before, Saturday, April the 3rd at the Jackson Middle School. It's going to be different this year. They still, have to restrict the crowd. We are going to confirm what the details are, but what they thought it would be because of the COVID-19 situation is a restricted attendance, probably maybe just parents. This number will be restricted because of COVID-19. I know they were trying to figure out a way so other people could see the contest if they couldn't be there. So we'll see what all those details are, but almost certainly it will not be, quote, open to the general public. Okay, last night, Jackson City Council met, a 2-hour and 15-minute meeting in open session. Then there was an executive session on some employment personnel matters afterwards. So it was a long night for the folks who represent our city. And we're going to be talking more about that and reporting on that, on some of the things happening in the city of Jackson. But a big news, we'll shout out a headline here. The city of Jackson, according to Mayor Randy Evans, is going to receive quite a bit of stimulus money in this latest round of stimulus money, and he is thinking in the neighborhood of $1 million.
What?
$1 million. Of course, Mayor Charlie Hudson of Wellston kind of reported the same thing at their council meeting last week. The best news about this, for our cities is that the use of the money is not as restricted as it once was in the beginning when they started passing out the stimulus money. What Mayor Evans is looking at is the same thing that Mayor Hudson is looking at: infrastructure projects, a lot to improve aging water and sewer lines and related issues in the city. Mayor Evans and his staff are working with consulting engineers to determine the cost of these projects so that if that money does come in, and it's supposed to, the city will be ready to maybe embark on some projects that they couldn't do on their own without the stimulus money. Mayor Evans talked about where some of these projects might be. We're going to review that as the week unfolds because it's a great thing potentially for the city of Jackson. Now, what Mayor Evans can say will happen for sure is they've got the income tax money coming in from the passage of the income tax last November. They are going to use a portion of that money for a paving program. Now, there's lots of paving needs in Jackson. If you travel the streets, you know that.
Yeah, it's called Broadway Street.
Okay, well, that's coming. Since you brought that up, I will say that they've got a grant-funded project, or partially grant-funded project, set for 2023. So I know that's
for Broadway Street?
A little ways, but one of the reasons is Bellisio Foods, who is located on Broadway, is doing a lot of improvements and construction, and they don't want to fix the street totally until all that is done.
Gotcha.
Because of all the trucks and all that stuff. So anyway, but We will tell you more about what the city would like to do, but on the income tax, there will be some paving done this year. It will be announced in the near future where that is, but it will be on a priority basis where the need is the greatest, and I'm sure where the traffic is the greatest. They'll factor all those things in. Also, another project the mayor wants to do in the next year or two is a GIS mapping project of the water and sewer lines in the city, so they know where they are and the public can know where they are, and folks who have business to know where they are will be able to pull up one of those GIS maps and know. Right now that is not there. But a lot happening in the city of Jackson. Okay, we want to tell you that this is National Agriculture Week. Did you know that, Jen?
I did not.
Okay, you're dealing in the food business, so you should know that. But it was proclaimed in both.
Thank a farmer.
It was, yes, that's right. They deliver the mushrooms to you, and you take
That's
it from
right.
there. National Agriculture Week proclaimed by the Jackson County Commissioners last week. There they are doing that. The folks from the Jackson Vinton Farm Bureau, Kim Harless there on the far left, she gets around, doesn't she? She was there along with Mickey Scott, who is the president of the Jackson Vinton Farm Bureau, along with the commissioners to proclaim National Agriculture Week in Jackson County. Later on Tuesday, this happened on Wednesday of last week. On Tuesday of last week, they were in Vinton County to do the same thing with the Vinton County commissioners, and there they are. That's pictorial proof that it happened. The commissioners are seated there. Behind them are Arnold Coffey, who is a Farm Bureau member on the board, and then Mickey Scott, and then, of course, Kim Harless standing there on the far right. You would be surprised how much agriculture is tied to Jackson County. No, there's not any large farms, but there are family farms. And two of our biggest plants, what do? They're in the food business. Mm-hmm. That's agriculture. We're connected with agriculture. So very important agriculture in Jackson County. So we had a story in the paper last Saturday about Agriculture Week in Jackson County. We have one this week about in Vinton County. All right, we want to tell you that later this week, this weekend, there's going to be 4 performances. The Viking players from Vinton County are going to perform a musical review of all the great music of the 20th century, taking it decade by decade. And these performers right here are in the costumes of the 60s, if you can't tell. But they will go all the way back to the first decade of the 20th century, all the way through the 1990s, and they will perform the top songs from each of the decades.
That's so fun.
So if you like music, I mean, a little bit of a musical lesson maybe for that music from way back, but I'm sure the kids will do a great job. Joy Henderson does a great job with the Viking Players, which is the drama club up in Vinton County. But tickets are now available for that. There's going to be 4 performances. Friday evening, March the 26th at 7 p.m. On Saturday, both at 3 p.m. and 7 p.m. And on Sunday, a matinee at 3 p.m. Tickets are now available at the Vinton County Clerk of Court's office in the courthouse. They figured out how to do it. They're going to restrict attendance by having 4 performances instead of 2 or 3. Mm-hmm. Therefore, not as many people at each performance, but they can socially distance and so forth. So they figured a way to do it. All right, we're going to move on real quickly. We wanted to correct something we reported last week. We were told that Hug Your Heart Day, that the Jackson Area YMCA does as a great day for the senior citizens, was going to be Tuesday, April the 16th. Well, the problem with that is that April 16th is a Friday. Oh. So mark that on your calendars. Mark off Tuesday, April 16th. It's not on there. Friday, April 16th, and it will be at Park's Edge. We'll be talking more about that in the future. And we do want to remind you that at a lot of the local cemeteries, they are asking you to remove old decorations from the graves in conjunction with the start of the mowing season. They have done that for Fairmont Cemetery here in Jackson. Decorations must be removed from grave sites no later than March the 31st. That's coming up pretty soon. Same thing in Wellston. Decorations should be removed by Friday, March the 21st. This is in conjunction, or I'm sorry, by Thursday, April 1st. That's because no more decor or artificial flowers will be permitted until May 21st. They want the cemetery pretty much clean for mowing in that 6-week period from April 1st to the 21st. You have until April 1st to get the old decorations off the graves. Tomorrow, Jen, basketball mania. I know everybody's sad about their brackets, all these upsets, but remember, it's all relative.
A little bit.
I mean, everybody's probably upset about the upsets.
Yes.
But on our basketball mania contest, which has been so popular, we have about 400 entries.
Holy
and tomorrow,
moly.
we will have an updated status report in the paper about where everybody stands. So,
wow.
So, buy the paper and you can see that tomorrow.
That's a lot of entries, Pete.
It is a lot of entries. I tell you, it's just like the Super Bowl. People get interested in it even if they don't like football.
That's true. You're exactly right.
Okay, well, the Holzer Health System folks are here, and they are here to help your health. So listen.
That's exactly right. We're going to talk about quite a bit of information today.
Right. So much more goes on at the clinic out on Pattonsville Road and at the hospital on Burlington Road, much more than people know, and they're going to enlighten you about that.
That's right.
Now.
You're about to hear it all. All right. Thanks, Pete. Appreciate you. And Pete's Morning News Update brought to you again by Nia Henry, agent for Appalachia Realty. If you do have any real estate needs, she is your hometown girl, the one that's been here for quite some time, and she knows the ins and outs of real estate around this area better than, well, probably anybody. Give her a call, 740-418-4135, and she'll be out working for you. All right, let's head on over to your Telegram News weather forecast, where they are still holding that spring subscription special. And what does that mean? That means you call the radio building here at 740-286-3023 to subscribe today. If you are in Jackson or Benton counties, you can get $10 off a year subscription. And that gives you both the print and the digital subscription. And it's only $3.75 a month. What? Mind blown. That's it. And the weather's looking good for today. So we'll take it. Partly cloudy skies today, highs around 69 degrees. For tonight, partly cloudy, lows of 53. Then on Wednesday, same warm temperatures, partly cloudy, highs around 71. However, looking on to Thursday and Friday, a little chance of rain popping into the forecast. But look, those temperatures continue to stay up in the mid-60s to 70s. So we will take it, and that makes us happy. And it's amazing what some sunshine can do to your your mood. So, all right. We do have one of our good friends from Holzer here today. Well, actually two, but one always wimps out and never gets on the camera, Marla. And, but no, our good friend Jennifer Spradlin is here today. And Jennifer is one of those that typically gets to hang out behind the scenes, but we grabbed her and nabbed her and made her, we didn't make her. We asked her to come and visit with us, and it's so good to have you here on the camera instead of in the peanut gallery.
Telling everyone else what to say.
Exactly. She's like, normally I'm behind the scenes telling everyone else what to say. Like, well, now somebody's going to tell you what to say. But no, welcome to the program. We're so happy to have you here, and we're going to talk about all things Holzer today, and maybe just give you an idea of some of the services offered that you may not know about, and that's pretty exciting stuff. So first off, though, introduce yourself. Tell everybody a little bit about Jennifer.
So I'm Jennifer Spradlin. I am local. I'm born and raised in Wellston. I've been with Holzer Health System for 12 years, and I currently manage 2 clinic locations. The first location being the family practice clinic of Jenkins Clinic in Wellston, which we have great providers there, and we actually have one of our providers that's going to be on here with you, Jen, I believe April 1st. Christy Massey's going to come talk.
Good.
And then also I manage the medical office building, which is the clinic not on the hill, but the clinic that is attached to the hospital on Burlington Road. And that is where the majority of our specialties are. And that's really what I want to talk about today. All those specialty services, now that, we're a year into COVID and we still have to take precautions, but, we still do have to take care of ourselves. And we have to see our specialists, and we offer a lot of those services. So you don't have to drive to Columbus or far away. You can go and see your specialist right.
And I have talked with so many people, and I think that they're not meaning it in a bad way. They're trying to be nice, and that is, well, I just didn't schedule my, I want to leave the hospital for people that are sick, or if I go and get my mammogram or whatever, I'm taking a doctor away from somebody that might be sick with COVID that needs help. And I think people kind of in their minds have had that thought, and that's not necessarily true at all. We want you to um, do those precautionary things that you need to do every year.
Well, and if COVID's taught us anything, honestly,
A lot.
well, yeah, that's a whole different segment. But it really, especially, people in their 20s, 30s, before, if you were sick, you would go to urgent care. You didn't really need to have a provider. And then COVID hit, and I'll tell you, being established with a provider and having someone that, does your physicals once a year, and then also if you were to get sick or, got COVID, unfortunately, you had that outlet versus trying to go into urgent care or be seen. You were able to get on the portal, which is a really good service that Holzer has, and you basically, can get on there and message through your phone or through your computer. Your doctors let them know how you're feeling. They were checking up on you. We want everyone to be healthy, and there are a lot of specialty services, for anyone that sees a cardiologist or, a GI specialist, your routine colonoscopies. These are things that really need to be done, especially now that we are getting vaccinated and the numbers are lessened in our area. The hospitals aren't as full. We want to make sure that we do preventative medicine too. We want everyone to be well. These things, keep you from possibly having serious issues in the future. So you're not taking away necessarily, from anyone else. We have teams in place. We have been really pushing, like I said, wellness and preventative medicine. And so please come out and schedule your mammograms and your colonoscopies because we want to keep you well.
And that's the whole thing. And this is being proactive and not reactive. I kind of try to live my life that way of don't wait until you find something wrong before you go to the doctor. Let's do these health screenings and the colonoscopies and all of that. Hey, I had a colonoscopy during COVID. It was A-okay.
Well, a lot of people decided not to, and that's it's okay. We understand. But we do have things in place, for your procedures or just seeing your specialists. Over at the clinic, which is attached to the hospital, we have an array of specialties that I think a lot of people don't even realize we have. We have sports medicine and chiropractic there. We have orthopedics with a walk-in clinic. So if you have an orthopedic injury Monday through Friday, you can actually just walk in. You don't have to have an appointment.
I didn't know that. How did I not know that?
I have no idea. We've had it for 3 years. This is why I'm here.
Good.
Yeah, you can walk in. You can see we have, 3 orthopedic providers there. We have podiatry. We have GI, which is, to schedule your colonoscopies or if you're just having any type of, gastric or belly issues. We have cardiology 3 to 4 days a week, which is more than we've ever had in Jackson before. And there are openings to be seen there, so you don't have to drive necessarily to Galplis to see your cardiologist. They rotate through that Jackson clinic. We have endocrinology, so for thyroid issues or diabetes. We have nephrology for any type of kidney issues. We have urology. We have pain management. We have physical medicine, and we also have vein screenings. So for anyone that, is having leg issues or they have some venous insufficiency, spider veins, we can actually get you seen there in Jackson as well. So, I just wanted to come on here and remind everyone because it's so convenient to be able, with working and kids and, just schedules, to be able to go see those specialists right there in Jackson versus having to try to get to Columbus or, Huntington all the time or even Gallipolis.
Right. I mean, that 25-minute drive to Gallipolis, I mean, you're talking about an hour out of your day, just drive time. So if you do live in the Jackson area, I mean, that's saving yourself some time. So that's fantastic. You know, and I was just thinking about this walk-in orthopedic thing because let's just all be honest. For the past year, we've sat around and been a bunch of big fat slobs, right? Because there wasn't really a lot we were out doing. You know, you didn't have organized sports a lot of the time and whatever. So what's going to happen as these 70-degree days like yesterday and today come out? People are going to go outside and they're going to overdo it. And they're going to decide to play a pickup game of something. And the next thing you know, all of us slobs are going to have sprained ankles and whatever. So that you're taken care of. Don't worry. You can head right up to the whole Holzer Orthopedic Walk-in Clinic.
Well, and Jen, the really good thing is we have orthopedics, chiropractic, and sports medicine right beside each other. So
they can all work
we can knock
together.
it all out. Yeah.
Yes.
We'll just move you down the hall and we'll get it taken care of.
Yeah, absolutely. And that's the big thing. You know, the cool thing that I've always talked about with Holzer, and I think a lot of people, I don't know if you appreciate the fact that all of this diagnostic testing equipment too is right under one roof, whether you're, you know, on Pattonsville or at the hospital location. You know, you guys have all of that stuff. So you're not sending someone to Columbus to go get something and then they have to come back and then you have to wait on results. And then, you know, it's all right there. And all of these specialists are working together all the time. They can walk out their door into the next one's office and talk. That's pretty cool stuff.
And I will say through all of this, and you know, we've dealt with other facilities too. Our radiology and lab teams have been amazing. We get our results very, very quickly, oftentimes quicker than going to a bigger facility just because they have, you know, decided that they were going to try to, you know, have everything as quick as possible, and they put in the time and effort. The teams are amazing. So, yeah, and they do correspond well with each other. You know, all the physicians, whether it's radiology or, you know, someone that's even drawing your labs, everyone kind of knows each other, especially, you know, here in Jackson at our locations.
Right.
And that's a good thing because you can just walk down the hallway and have that conversation versus trying to look up, you know, someone and getting a hold of them, and the hassle or just the timely experience that can be sometimes.
You know, and let's just be honest, you know, we've talked about small town living and it has its minuses, but it sure as heck has a lot of pluses. And, you know, when you head out to Holzer, you're always going to see, number one, a lot of smiling faces, but you're going to see a familiar face probably. And that helps too. I know when I went up for my colonoscopy, you know, it's just like, you're a little nervous and you're scared and you're not, you know, it's just kind of weird. And, you know, to see a couple of familiar faces up there and be taken care of is, it makes all the difference in the world. And that's what you get at Holzer, and I think that's pretty cool stuff.
And you get a Sharon Kite hug.
Pretty much. I mean, I wasn't going to throw her out there, but yes.
No, everyone in Jackson knows. It's okay.
She's the best.
She's the best.
She's so
If you
so
have a
the
colonoscopy
best.
in Jackson, you get a hug from Sharon Kite.
You do. I got my hug after she told me I was COVID negative.
Well, yeah, she waits. She waits till after those results are in.
But no, it does, you know, it does make uncomfortable situations a lot better when you do see smiling and happy people. And they're happy because they like what they do. Actually, they love what they do. So let's talk for a minute about COVID and some of the challenges that you faced in running these facilities during a global pandemic that no one in the world could ever plan for. Let's go back a year. What were you doing a year ago and thinking about the future of this pandemic and what it was going to, and could you, in your wildest dreams, could you imagine that a year from now, or, you know, a year later, we'd still be dealing with it?
No. So, especially when this, you know, everything first came about, I think everyone in healthcare, I mean, we prepare for this. Yes. Your physicians, your nurses. I mean, it's always one of those things. I kind of related it to the military. You know, I mean, you're prepared for these types of things to happen. You just hope they never do. And no, I don't think anyone really had in their greatest imagination an idea of how big and long and bad all this was going to be. I can say that, for never, none of us have lived through a pandemic. None of our administrators and leadership, with Holzer or any of the health systems had experienced a pandemic. And I think across the board, all of our health systems here, not just Holzer, they have went above and beyond. It has taken hours and hours and hours of planning and meetings, and I know for us we have a lot of things in place, and it was touch and go. I mean, like everything is in the beginning. It seemed like every day we would find out new information because the government and really no one knew much about it. So as they were releasing new information about COVID, then we would have to change policies and kind of on a dime. And I have to say that, our physicians and our leadership with Holzer, they worked really, really hard. And we have some really nice things in place to keep everyone safe. We kept trucking along. We kept taking care of everyone. We didn't shut down. We didn't try to keep people away necessarily. We just had to figure out how to make sure that everyone was going to be safe. And we have a lot of measures in place. I feel like we've done a good job of that. A lot of that will most likely stay in place even after all this calms down, or I'm going to knock on wood because I want it eventually to go back to normal, hopefully. But a lot of that will probably stay in place, and it's just because the patients really enjoy it, and it's very convenient for them. And so it was a learning curve for all of us, but I do have to say we've tried our hardest to make sure that everyone, didn't get exposed, that everyone was able to continue the care that they needed the safest way possible.
And I was thinking about a couple of different things. Number one, you guys, it is kind of like the military. I mean, you all were trying to take care of other people during a global pandemic when you're putting yourself at risk to take care of other folks. And so you're trying to implement procedures to keep your staff safe and the patient safe. And what a big old mess that had to have been. But yeah, I was thinking too of some of the fun things that came out of this, maybe like virtual visits, something that will probably continue on, I would assume.
Yeah, virtual visits, they will continue on. They may change a little bit from the current state, but patients really like them. And, that was one thing. It needed to happen very quickly. And like I said, we have some committees and some leadership that they threw this stuff together within weeks almost, and it was amazing. Virtual visits, and if you've not done a virtual visit, I promise you, once you do one, you will probably not want to actually do a normal visit again. And we offer both, so there was some confusion on that. If you want to come in and see your doctor, you are more than welcome to come in and see your doctor. We are not forcing you to do a virtual visit. But if you would rather do a virtual visit, if it's just a checkup and your doctor says, that your visit's appropriate for it, then basically, you get a link on your phone and you click that link, and it's almost like you're FaceTiming with your provider. And so they do everything that they would do in the office, all the questioning and things like that, through your phone, and you basically can just sit in your living room or wherever. Or, if you're in an office somewhere, you can do it from anywhere, and it's very, very convenient, very easy. You don't have to really worry about, downloading a program or jumping through hoops. You just click on that link and you're ready to go. So if you have any inquiries about that, please get a hold of any of your local branches. I'm going to give a number at the end. So that's our phone center number, and anyone, that maybe has an appointment coming up and they're wondering, well, could I do that virtual? You can call the phone center and they will take care of that for you.
to kind of try to ease up a little bit of confusion on the virtual visits, because there's sometimes they're not appropriate for, what's happening. So could you give a scenario where it is appropriate, and then a scenario where a virtual visit just isn't probably the right thing for somebody in that particular case?
Well, so for instance, orthopedics. I mean, obviously, we can't fix your broken arm over your phone.
That would be nice, but
listen, we're working on it. We're working on it. Send Todd Fowler an email and tell him to figure that one out. Basically specialties. So a lot of time on your specialty visits, you're going to need to go into the office because they need to do some sort of, physical examination. But if it's just a recheck, so let's say your internal medicine doctor, your family practice doctor, or maybe even your nephrologist changed your medication, and they said, I want to do a recheck in 3 months to see how that medication, how you're doing on that medication. That would be appropriate for a virtual visit, because they're basically just talking to you about the change in medication, how you're feeling. They don't have to do that physical examination again because they had just done it. A lot of our family practice doctors and nurse practitioners at Jenkins, every 6 months, if you have some things going on, they want to physically, lay eyes on you, touch you, do the full examination. But for those rechecks in between, they'll do the virtual visits. Or, especially with COVID, if someone was having symptoms and we don't know if it's COVID or maybe, and you brought this up earlier, but sinus infection.
Oh my gosh.
Allergies.
The allergies are awful already.
And last year at this time, that was a big confusion.
Which one do I have?
So that's perfect for virtual visits as well, because you may just have allergies, but we don't want to take the chance in bringing you in and exposing you to anyone. And also, if you're already feeling, kind of icky, we don't want you to have to leave your house and come out and, be around other people too. We want to go ahead and do that on a virtual visit. Now, we may send you over to our swabbing station to get swabbed if we do think it's a possibility of COVID. But that also, you stay in your car. It's a drive-through process.
It's fantastic. It is like the most slick thing I've ever seen in my life.
Did you get to, well, you did have to do it for your colonoscopy.
I did.
You have enjoyed the drive-through swabbing services.
I did. I mean, as much as drive-through swabbing services could be enjoyed, which isn't very much. Listen, you have not lived until you've had a COVID test. And if you haven't, just go get one. It's fun. It's a party.
Well, I would say there's very few at this point that get to claim not. I think if you've not had to have one yet, you should hold on to that.
You should consider yourself very lucky, yes.
So looking back on all this, in 20, 30 years, you can be like, but I never, ever had a COVID test.
I know.
Like, I feel like it's bragging rights.
It is. Like, there should be a sorority.
Like a secret group?
Yeah. Secret Facebook group or something. I don't know.
Well, someone might start it. Now you've got the idea out there.
I know. How can we monetize this? That's where my mind always goes. But no, that swabbing station, all kidding aside, I will say the very nice girl came out, and of course she's like, now, don't jump, don't swat at me, do not punch me. And I was like, lady, I am not going to touch you. You got a big swab up my nose. It's not going to happen. I promise you. But they are very, very fast and very, very good at what they do. And obviously have had a lot of practice at it, unfortunately. So, but yeah, you just drive up, done, and you're out. It's like literally a minute.
Yeah, you barely put your car in park.
Yeah.
And they, go through everything and you're done and you're on your way.
Yeah.
Unfortunately, my children had to be tested along with myself, and I was just like rolling down the windows to the back seat, and they sent 3 people out. So they just like all at once, and then
that's
we were
awesome.
done. Yet the swatting, the hitting, the kicking, that they probably got that from my 6-year-old, and then that's why, because it took all 3 of us to hold her down.
Well,
so they were probably traumatized from her when you came through.
I'll remember that. It's all your fault.
Yeah, it usually is.
That's hilarious. No, it is. And honestly, the best advice is just sit on your hands if you have that reaction ever to like jump or whatever. I was like, she said, if you think you're a swatter, sit on your hands. I was like, I'm not, but I see where you're going with that. So
Yeah, and resting your head, just on your headrest in
yeah.
your car, that helps too. Because, I mean, if someone's sticking something, up your nose, you have that normal like pull away instinct.
Right.
So we always have everyone just kind of relax and rest their head. But like you said, the girls that do the swabbing at both locations, they are fantastic. I mean, they've been in all weather doing these things.
Yes.
Through the winter, through the rain. They are just fantastic, and they are very, very nice, and they're very quick. So hopefully you don't have to have a COVID swab. But if you do, we do have things in place to where you don't have to get out of your car. You can just drive right up and get that done. We also have thermal temperature machines at our locations. Not at all of them, but some of them. So that's something that came from the pandemic, and that's a precaution that Holzer takes. So if you see like a little silver stand when you're walking into a location, you just walk in front of it, and it's going to look like it takes a picture of you, and it basically takes your temperature and tells you what it is. And then you can go right in and, see whoever you needed to see in the building.
Cool.
So there are, a lot of hand sanitizing stations.
Mm-hmm.
We really have tried to make everyone as safe as possible. We also have a lot of kind of check-in services. So even for urgent care, lab, radiology, you can register in the parking lot, sit in your car until it's your turn.
How do you do that?
So there are signs and numbers according to which location you are going to and what service you need.
Gotcha.
So if you need lab or pharmacy or urgent care, the pharmacy basically is curbside. So if you go over to our Pattonsville branch, there are a couple of big signs, almost for like Bob Evans carryout.
Mm-hmm.
You'll park over if you need to pick up your prescriptions, and there's a number on that sign, and you'll call it, and you'll say, I'm here to, this is my name, I'm here to pick this up, and they'll run it right out.
That is fantastic. And again, those are maybe services that can continue on. I'm thinking about moms, like you said, with your 6-year-old. It's a lot easier to just sit in the car and have someone bring it to you than to get all the kids out of the car and go into the pharmacy and all of that. Fantastic.
Yeah, and, just not having to wait, let's say, urgent care. You're feeling kind of yucky anyways,
Mm-hmm.
and then, there is a generalized concern, especially if you have sick kids, to go into a really busy waiting room, and we understand that. So you can, call that number, go ahead and get registered over the phone, and then just wait in your car until it's time, and we'll get you straight in to see that provider. And so that way you don't have to worry about, maybe exposing your children or, exposing yourself or your parents, anyone with serious health issues. So that those are things that I believe will stick around. They'll grow as time goes on. I have to say, with this pandemic, I am ruined because I will never go grocery shopping again. Like, I didn't click list until COVID, and I will never not click list now.
Really? I've never done it. Is it so cool?
It's life-changing. I mean, because you don't even have to get out and open your trunk. Like, they literally they open your trunk, they load everything up, then they hand you your paper, and you're done.
Fair.
That's it.
That's so cool.
And you can even tell them you're on your way, so you don't have to wait that long. It's amazing. It's amazing. And so things like that.
It's like magic.
It is. I will never, ever go into the grocery store again. But, things like that. Everyone, not just healthcare, just like the stores, and I mean, even you with the restaurant.
Sure.
We've all had to get so creative.
Mm-hmm.
And a lot of this, I believe, will stick around just because it is really convenient. So, utilize these services. If you need to see someone, pull up into those spots and call those numbers. If you want to maybe do the virtual visits, I will give you the number here in a few minutes to call and get everything switched over. But please utilize these services, and also please do your preventative stuff.
Please.
We want you to be healthy for when we all get to hang out again soon. So please take care of yourself, and we will do the best that we can to make sure that you are safe as possible while you do that.
All right, let's bounce over to the COVID vaccine that she so sweetly kind of told me that I'm a dum-dum for not getting yet.
That she still has not gotten, although
Yes.
I personally have called her.
She did. Listen, that's the kind of service you get. Hey, I have a vaccine over here. You need to come get it.
And she told me no.
It wasn't because I didn't want to. Well, I really don't want to, probably, but no one likes to, get their vaccine, right? But
Well,
no,
actually, no, that's not true.
That is true. This one, I'd say a lot of people are very excited to get.
So, I mean, we've been given flu shots. I've been a nurse. Oh my.
A couple years.
14 years? I'm going to have to carry the one on that. I believe about 14 years. But, and I've given a lot of flu shots. No one has ever, hugged me or, jumped up and down or told me how excited they were for a flu shot, ever. But for this vaccine, I mean, we have had patients that are so excited. I mean, they come in early. It has been on their calendar.
Aww.
And so people
so
actually
good.
are excited, and it's fantastic because everyone wants to be able to see their loved ones, and we hear a lot of stories of, now I get to fly and see my granddaughter,
Mhm.
or, now I get to, go in and see my mom at the nursing home, and I've been, staying away to keep her, safe. And so there are a lot of people that are extremely excited for this vaccine. It's really heartwarming, honestly, just
Sure.
to hear everyone's different stories and see their excitement.
So, okay, so say Jen wants to schedule a vaccine appointment at Holzer. Is it number one, there's a number that you call, and I can't remember what it is. I know the numbers are 5533 or something like that. To schedule the COVID.
Well, or you can just
test.
call the generalized phone center.
Oh, you can?
Too. Yeah,
Okay.
And they will direct you to where you need to go. I mean, if you just call the phone center number, if you can't remember the vaccine number, they will get you to where you need to go. Or if you are, already seeing a physician in one of our locations, you can tell reception and they can get you scheduled for that as well.
With your own physician? Or
yeah, well, no, it'll be at one of our locations.
Okay.
So, and I'm sure Pete has discussed this, in the beginning, there were only certain locations that could get the vaccines.
Mhm.
They've opened it up. There are more locations in just the state now that can get the vaccines. But transport, just storage of the vaccines.
Mhm.
So right now, the CDC isn't allowing just your doctor to give those because of the storage, the
Gotcha.
transportation. It's easier right now as we're doing mass quantities to basically have one or two locations. So on Tuesdays and Thursdays right now at the hospital, so that's the Burlington Road location.
Okay.
We've been doing vaccines there for several months, and then the Pattonsville location just started doing vaccines as well on Fridays. So as we get more vaccines at other locations, you'll see the availability open up. And then Galplis, Marla, how many days a week do you remember is Galplis giving there? 4 days a week.
Yeah.
So our main branch in Galplis is administering vaccines 4 days a week. So there is availability. We're trying to focus right now on 40-year-olds and up. Obviously, Pete just said earlier that 18-year-olds and up, they're opening it up for that. And so what we've been doing is maybe it's not your age group yet, but you want to go ahead and get on the list. We would put you on the list, and then if for some reason we had extra vaccine, if somebody no-showed, or with the health department and other, I believe Kroger and some other locations have the vaccine now. So people will sign up for several lists, and then they'll go and get the vaccine from whoever calls them first. So
Sure.
we'll have some no-shows. We'll have some availability maybe on the schedules we didn't know we were going to have, and we'll start working down those wait lists. So we have a lot of people that have been able to get in that way to get their vaccine. But also, I mean, we're working just as quickly as we can to get everybody vaccinated. We in Jackson so far have had Moderna and Johnson & Johnson. So it's according to what day we're doing vaccines, would be what type of vaccine you would receive,
Okay.
unless you've specified. I know that I think there's some other locations around here that have Johnson & Johnson and Moderna and Pfizer. So yeah, I mean, basically just call in the number and give your information, and we'll get you on the schedule.
Do you actually get an appointment time, or is it just you have to show up on that day? Because an appointment would be awfully convenient.
You get an appointment time.
Oh, great. Okay.
Yeah, so the way
That would be
we
good.
do the vaccine clinics in Jackson, you would come in and fill out some paperwork, get registered right there at the front desk, like at the hospital.
Mm-hmm.
And then you would go in. If you had any type of allergies or any type of health issues, we have a pharmacist on site that you would discuss all that with. He would review your paperwork.
Okay.
And then you go over, get your vaccine. They fill out your card, and then we have a monitoring area with a couple nurses where basically you just sit for 15 minutes to make sure that you're not going to have any type of
Sure.
reaction. And then we give you all of your instructions as far as side effects or, different things to watch out for, what to do if you would happen to have some of the documented side effects. And then you're right out of there. If you're getting, let's say, a Moderna vaccine and you have to come back for your second dose, you walk out of there with the paperwork that needs to be filled out in your hand, your card, and your appointment for the next shot.
So you're not left hanging.
Yeah, you know exactly when
Okay.
you have to come back. You've got the paperwork that you can fill
Good.
out at home. So when you come in for that second dose, you basically just hand the receptionist the paperwork and you get right in.
Okay, fantastic. So that kind of answers all my questions when it comes to that, because I didn't know, because you have kind of the health department doing just the walk-in thing, but it would be really convenient if you could just know you have an appointment and save some time.
We've done appointments just because it is easier, and it's easier for us to try to keep the flow.
Mhm.
With us watching everyone for 15 minutes in a monitoring area, we don't want everyone to kind of just come in real early in the morning and us have, kind of too busy at one point in time. So that way we have the scheduled times. We have X amount of people scheduled per 10 minutes. And if your time maybe, you call in and say, well, I was scheduled for 1 o'clock, but I really have to do 9 because, I have something going on. That's not a big deal either. We're very, we're okay with people coming in on, at different times if that's what's better for your schedule.
Okay, very good. And are there any suggestions like what to wear? Obviously, it's in your arm, so you want to wear something where you could pull up your sleeve, probably.
You want to wear short sleeves or something that's loose fitting, unless you want to take your top off.
Depends on how many margaritas you've had that day.
It's really up to everyone. But
we're kidding.
We might be kidding.
I mean, we're not.
No, actually, and I'm going to bring this up just because I know that he wouldn't care, but your dad, he was a forward thinker because he took his jacket off and he was like, I wore short sleeves. I was ready. And I'm like, oh my goodness, thank you. Yes. Because you don't usually think about it. But yeah, short sleeves. You do want to prepare. Your arm may be sore later on that day or the next day. That's something, just according to what you do for, a living, or, if you have things scheduled, prepare that you may have a little bit of a sore arm. I tell everyone to just let their bosses know, if they're getting the injection, they may not have any issues at all, but just a heads up, or maybe not plan, a big trip or something the next day, just in case you would have some of the side effects. That way you can just rest.
That's right. And, I've talked with people and it's run the entire gamut of nothing to, wow, I was laying on the floor for a day with chills and, I was miserable. So you just don't know. You have no idea. So, all right, girlfriend. Well, we are out of time today. And I know that it's a shocker to everyone, but Jen and I don't typically have trouble talking with each other. So we weren't really worried about filling the time.
No, talking's never been a problem.
Is there anything else you would like to tell our viewers before we let you get out of here for the day and get back to taking care of our local folks?
You put the number up a minute ago, right? I could have swore I saw that. Okay.
Yeah.
So, just call that number if you need anything really, as far as just information about the vaccine, information about swabbing, information about any of our services right now that we are offering with COVID and the pandemic. Just call in and ask about it. Our operators would be more than happy to explain the different things that we're offering and answer any of your questions. So, and also don't forget, if you need specialty services, please look into Jackson so you don't have to put all that really expensive gas in your car to drive far away.
No kidding. All right. Well, Jennifer Spradlin, thank you so much for being here on the program today. We greatly appreciate it. And we always love our friends from Holzer. And one of these days, we're going to get Marla on the camera.
Nope. Maybe the day that you get your vaccine.
Maybe.
Now we just up the ante.
That's right. No pressure or anything. All right. And please do call any specialty services that you need or the vaccine. Please let Holzer help you out with all of your needs for that. All right. Have to get out of here for the day. We hope you've enjoyed the program. And we will be back here tomorrow where we will talk about, well, we don't know, but we'll talk. So have a great day, everyone. Thanks for watching, and we'll be right back here tomorrow.